This is Eric Topol for Medscape, for Medicine Machine podcast, and it is a special privilege for me today to welcome Dr. John Whyte, who is the Chief Medical Officer of WebMD. Welcome, John.
Thanks, Eric. It's great to be with you.
Well, it's a real flip because John has interviewed me multiple times during the pandemic. I get to interview him, and I want to start off to our listeners about John's remarkable background. He had his internal medicine training at Duke, then he went to Harvard for the Chan School of Public Health to get an MPH. Then he went on to Stanford and did health service research. And he had a couple of major gigs in government with FDA and CMS, and been at the Discovery Channel, and then in recent times, WebMD. So this is really fascinating because you've had quite a diverse career, John. The real, I would say, marked differences between working in the government and working as one of our major medical communicators. So can you tell us how you span that gamut?
Yeah, Eric, it's funny is because a lot of people see me as a communications expert, but I've always thought of myself as a policy person. And I've always seen patients. So even now I see patients, I try to one day a week, even at FDA, they would allow that one day every 2 weeks. And, it's a lot of work because you have a day job, but I've always done that. And you're right. The environment of government versus the private sector is completely different. The government, you're in meetings all day. Every meeting has about 30 people, especially if you're with the commissioner or the secretary, that's like 40 people, like two people talk. And you think this is not always the best use of time, a lot of paper. We would joke, Eric, when you'd say something's going to be released October, people will say, what year? And they're serious because sometimes you're talking your way. And in the private sector, you're like next Tuesday. And it's like, well, why can't it be, this weekend? But it's always been from this perspective of, I want to impact populations of people. So I can impact people one-on-one, as a physician. But, I worked at Medicare and I was able to help determine what services were covered under the Medicare program and what the criteria were. At Discovery Channel, it really was about translating research into practice. The term TRIP, no one outside of like health services research uses that. But I looked at it as, you know what? I got a big denominator, 100 million people have Discovery Channel. If I can help educate a few people on diabetes or heart disease or certain symptoms of stroke, that's a good thing. So it's in my mind, it all kind of makes sense and flow.
Now I see the common thread between impacting, people at scale. Now, for you to translate the complexities of medical information to the public, because WebMD really is a major resource for the public to get their information. How do you imagine? How can you do it? It's so darn hard. It's hard enough to communicate to medical professionals.
Yeah, it takes a lot of practice, to be honest, and I don't always get it right. And, I really learned it when I went to Discovery Channel, where it's about the power of storytelling. And if you think about it, that's how we train in medicine. We tell patient stories, and we use those as, an emblematic type of, of story that we can learn from. And what I've always done is I always try to almost talk to myself in a way when I'm writing something or reviewing something. Like, this is not the way you would talk to a patient, when you read something. Or in medicine, we really have this parlance, even just that word in itself, our lexicon. We have words that people just don't use, and we forget that they're not used. The other day, I said to my wife, I said, that I actually said the refrigerator is malodorous, and she's like, "What? What?" I'm like, she's like, I said, smell. She's like, people don't use that term. I'm like, yes, they do. She's like, no, they don't. But we forget that, and we use terms and language, and then patients can't understand us, or a reader can't understand it. And Eric, one of the great things about, the media world, though, is we do have powerful matrices. So I can see if a story isn't doing well. on WebMD or a video isn't doing well on Medscape, just as I could on, on Discovery Channel. And that tells you something. You have to go back and see, well, what went wrong? Was it, too technical? Was it too simple if it was for a physician? The great thing about WebMD and Medscape is, they're different audiences and you got to stay on your toes. That something for physicians is not, sometimes it's a mix, but for the most part, it's not. And, COVID has been a great example because now we're using all these terms, it's like an immunology lesson every other day. I've been honest and told you, I've learned a lot from reading your tweets, but sometimes then I have to go back and do my own, research as well and pull the article to learn more. So it's, it's a process where I don't always get it right, but I keep at it.
Well, I've been impressed how you've been doing this, and it's particularly, as you've mentioned, during the pandemic with lots of new jargon for the public. Are they familiar with variants? And speaking of new jargon, today the headlines of the New York Times is about herd immunity. It's not attainable, and a lot of people all fired up that we were going to get herd immunity and all these vaccines, and now what? And it seems to me there's a lot of confusion that, hey, if we could just get an incredible level of containment, the likes of which we're seeing in the UK and Israel, that'd be good. How do you explain a concept like herd immunity as compared to, containment to the public?
Many times you have to use images. So the irony is on herd immunity, we've used a lot of infographics and images, and people can understand the concept that if a virus is looking for someone to attack, they're going to find that weak sheep or that person who isn't immunized. And that makes sense. I think herd immunity is a good example where we focused a lot on that. And if we really look at it from a scientific perspective, it's really a mathematical guess. We don't really know. And all the people that are out there, including some esteemed people that'll be like, oh, it has to be 80%, it has to be 90%. We don't really know that. And to say that with certainty can later misinform people. And we need to say, hey, you know what? We need to get as many vaccinated people as we can. This is the way that we're going to protect. People can understand a virus can't mutate if it can't survive. So don't let it be able to thrive in your community. People can understand that because in some ways we could say herd immunity. Okay, if 80% of people get it, then I don't need to get it. And that's not what we're saying. And now we have these stories. Well, what if the variants come in and you can go in and out of herd immunity? It's just confusing people and it's really unnecessary. And I think sometimes we have not communicated well the concepts that people need to protect themselves. And I've talked about my pet peeve, and I know it's one of yours at times, is 6 feet, 3 feet. I mean, we say it with certainty as if we really have data, and we don't. And I think it can cause harm. When you change things, people don't like that. And we should change things when we get more information, but we shouldn't promulgate certain data points either.
Right. Your background in public health and also in health service research, where you did a lot about diversity in clinical trials. This seems to be one of the, big issues. Recently, we had Tom Frieden on the podcast.
I listened to it.
We discussed the issue about that the shots in the arms are going in the wrong arms, or not enough of the right arms, namely the people who are the least likely to show up to vaccination sites. Can you tell us about what we need to do to get the kind of this last mile, this hardest group of all, to get them to be part of the immunization group here?
Right. I mean, COVID has shined a light on disparities that we no longer can ignore. And I was interested in this topic actually as a resident at Duke when it wasn't that popular. I wanted to look at the difference in care and the management of dyslipidemia. And we saw even back then that people of color did not get prescribed statins to the same degree as, Caucasian people. And here we saw that people were catching COVID at a much greater rate as a percentage of population, having more serious infections and deaths. The problem that we've had in immunization is we talk at people instead of talking to them and talking with them and listening to their perspective. I get a little annoyed at times, honestly, when I keep hearing that, statistic, everybody lives within 5 miles of a pharmacy. And you think, oh, that's really easy. Well, you're thinking that because you have a car. You probably have 2 cars. You have an Uber account. Well, guess what? If 5 miles is pretty far, if you don't have a car, you don't have a way of public transportation to get to, it's not that easy. So what we need to be doing is, in West Virginia, in some rural areas, they were bringing the vaccine to people that need them, that couldn't get out or couldn't get somewhere. We need to make it easier instead of this, complicated scheduling system. Now that we have much more supply than demand, you can go to the local mall where I'm at and now get vaccinated without an appointment. They're doing it at gas stations. We've talked about the role of barber shops and other areas. And then we also have to have, honestly, fewer of you and me, Caucasian, guys, and have the influencers in their community talk about why it's important to get vaccinated. What I often tell patients who are hesitant, I say, talk to a friend that got vaccinated. See why they decided.
That's a good tip. And I like the concept somebody's come up with, this, like the DoorDash for vaccine.
Yeah.
Go door to door and just.
Yeah. We should have had Amazon run it.
There you go. Now, another area that's very troubling in the pandemic is the polarization of this. That is, you've got, the biggest resistant subgroup of all. Yeah. It's not so much the minority, underrepresented groups, but rather the Republican Party, particularly, I guess, male Republicans, where 50% are not willing to get. How do we deal with that? Do you have any remedies for this problem?
I mean, that started, from the beginning at the top, where a lot of miscommunication about the virus itself, that it wasn't contagious. We were going to be done by Easter, remember, of last year. And, Easter has passed, and Greek Easter just recently. And we're still, have a bit of way to go. Eric, where I think we're actually going to see improvements is this, not as much, to be honest, as despite, my role in the public sector. I think the private sector is going to drive immunization in that community. And where I mean is, even if you think about, in terms of younger people that haven't been wanting to get vaccinated, 100 colleges and universities are making it mandatory. So you want to return to campus in the fall? And let's be honest, they do. You don't get vaccinated, you're not coming. Houston Methodist just announced mandatory vaccination. I'm surprised more hospitals haven't done that. And I think we're going to see that. West Virginia is giving $100 savings bonds to people 18 to 36 if you get vaccinated. I think we're going to see, perhaps on travel, if you want to get on a plane or certain transportation or cruise ship, you're going to have to prove that you're vaccinated. I think that's going to drive that change because I think the sides are so hardened. I'm not sure talking to them about the data and talking to them about the science is going to make that much of a difference. And we know the president got vaccinated, the previous president, the former president, the former first lady got vaccinated, but they didn't talk about that. And, we missed an opportunity. Yeah. And we've missed that opportunity. But when people want to travel and go to concerts and do other things, I think, and go back to work, I think that's going to drive immunization in the next phase.
Medicine and the Machine will be right back.
Welcome to Medscape's latest podcast series, Medicine and the Machine, featuring Medscape's editor-in-chief, Dr. Eric Topol, and master storyteller and clinician, Dr. Abraham Verghese. Remember, you can find the latest in medical news, expert perspectives, clinical tools, continuing medical education, and more at medscape.com.
Well, you touched on a really important point, which is why aren't all healthcare workers having as a mandatory step to get vaccinated? We know there's still resistance among some healthcare workers. And you mentioned one example of Methodist in Houston, but there aren't that many now that have made this a mandatory thing. Now, the excuse here at Scripps in San Diego is, well, it's not gotten full licensure yet.
Mm-hmm.
What do you think about that excuse? Because that could take another few months before we see the U.S. vaccines getting the so-called BLA, biologic license approval. Would you, there's hundreds of millions of doses out there, right? I mean,
Pfizer and Moderna both had announced that they were going to, submit their full BLA. At one point, they said it was going to be April. That hasn't happened. They're focused on getting, the 12 to 16 or 12 to 15 vaccination rate. But I agree, where I do my clinic time, it wasn't required. And I was kind of surprised because for influenza, they come around and jab you.
Yeah, really.
But they literally will come to you in the clinic and do it. I think that's going to change, Eric, because I think at the end of the day, we can say hundreds of millions of people vaccinated.
One of the things that we did together was we had an extraordinary interview with the FDA key players, namely Commissioner Steve Hahn and Peter Marks, who oversees the vaccine work with convalescent plasma and many other aspects of the pandemic. I wanted to get your sense, since you have inside FDA experience, what is your feeling about how they are doing throughout the pandemic, throughout the issue about approval of the 12 to 15-year-old vaccines? Let's get your appraisal about the FDA.
I'm not going to talk about the former leadership per se, where I think had challenges in terms of communicating about science and standing up for science and data. And there's a reason why we move cautiously, even during a pandemic. But, I also want to point out, Eric, in 2020 was the second highest of drug approvals in the last 10 years. Wow. So they did all the work on COVID and their day job in terms of approving new drugs, second highest, in 10 years. They have worked around the clock across the different centers. It's not just drugs on devices. And let's be honest, the challenge is, you and I know this, data are often gray. They're not black and white. The decisions aren't easy. It's interpretable to, a certain degree in how you evaluate risk. So I think they've done better than even, one would have hoped in terms of working over the weekends, working 24 hours people don't realize the amount of work that has to go in. They look at every piece of data. They corroborate every piece of information. Not all regulatory agencies do that. And at the end, they often have to make difficult decisions that are gray. So I think they've done a spectacular job. I think it hasn't always been communicated well. Convalescent plasma, some of the other pronouncements, hydroxychloroquine and others, and that erodes confidence. It's the same for CDC. Let's be honest, some of their guidelines back and forth changing. But I feel we have more steady leadership. You and I both know Dr. Janet Woodcock, the acting commissioner, who is very much someone about data and science. You may disagree at times with interpretation, but there's data to support decisions. And I think it's the same trying to at the CDC. Although I'll be honest, I feel their recent guidelines on masks, I do say, whenever you need a flow chart to explain something, it's not simple.
Well, did you happen to see the Trevor Noah takedown of the CDC? That was extraordinary. On the mask, the new color coded, vaccinated, not vaccinated, green and red and yellow.
It's too much. It's like, do they not go to a focus group? Do they not ask someone not involved to look at it?
That's where your expertise in communicating complex matters to the public, which I think is, just an extraordinary strength you have. And
well, thank you.
I mean, maybe the CDC needs to consult with you before putting that out. Maybe
you know what goes on there, Eric, just having worked there. I will tell you, one time we looked at an assessment to put out like a press release. It's like 25 people sign off on it. I think it's gone down to like 14 or something. And you know what happens? I joke, everybody's a writer. Everybody's an editor. So by the time you get a document back, it's been parsed so much. And that's what would have happened with this graphic. I'm sure it had many iterations that people change. So by the end, you barely can understand it. And, they don't focus group test it. They don't, ask for other people to look at it. And you think, how much time did they spend on this? And I'm still confused on point 2 and 3 on the unvaccinated outside, if it's one person or multiple people. And I'm sure 100 people have looked at it. So how can this not make sense by the end? You ask a 10th grader, to explain it. They need to use what I've learned, the talk back test. So I do use that with patients. So I say, okay, what's the plan? After I tell them the plan, and half the time it's not the right plan. And then I write it down, and then we go over it. And I just wish they did a better job in communication. They really have not done as well as they could. It's almost like an afterthought. And they need just regular language. Honestly, I also tweeted the other day, enough with the virtual backgrounds. Just be a regular person talking to us about what we need to do and the expertise. And you don't need your notes. You don't need the sound bites, but just be practical and explain it. That's what people want and are yearning for. And that's why other people on the internet are doing well, sadly, that are giving misinformation, because they're using a language people can understand.
Yeah, well, that's an important point you're bringing up too, which is you've been talking about, how we can communicate effectively about the science and complex matters. The other is the disinformation. Peter Hotez has called for an active counteroffensive to the disinformation, which is not only hundreds of websites and tens of millions of people, but even Russian interference to be divisive. Do you think that there's room for that? Can we actually mount a counteroffensive to the disinformation?
I don't know if we can actually accomplish that. I think part of it is, you did a great example when you kind of coined that term scariant. Makes sense. It's a variant. Scary, but are we overdoing it, right? So something very simple, I can remember it, it makes sense, and they'll get the point. I think part of the challenge, Eric, is, and I've been talking a lot about this, every piece of good news is countered by some bad news. And people are just getting frustrated. So, I understand, Peter's point. I've interviewed him about it can't always be negative news. So even though we need to talk about what's going on in India because of its relevance globally, give us a day or two to acknowledge. Even though it's not 3 million shots a day, 2.6, 2.7 is still pretty good right now. It's no need to panic right now. 85% of the population over the age of 65 have gotten at least one shot. 75% are fully immunized. We should be pointing out the 7-day decrease, in new cases, the 7-day average in, cases, new cases, deaths, hospitalizations, mapping that to immunizations and pointing out immunizations work. That's why this is going down. And not, I have to page through. You and I do it, graphs and graphs and graphs to pull it together, but they don't make it easy. And that's how we show people vaccinations work. That's why the death rate has gone down.
Right.
That's why the number of new cases. And let's point out where new cases are still going up. And that's an issue of lack of vaccination and variants. So part of it is, you counter misinformation by having a balance and also addressing it. How many times do we have to say these don't change your DNA? But Eric, I would ask you this: when we say they don't cause, we don't exactly say they don't cause fertility issues. We do parse our words carefully, and that there's no data to indicate whatever. But people understand that. I'm still getting that question about fertility, and I think that's going to be a challenge in some ways for a younger population as well, as we try to get them vaccinated. If we don't adequately address that in a way they can understand.
Yes, no question about it. Now, in wrapping up, I do want to comment about a quality of yours that I find especially alluring and infectious, and that is your humor and your upbeatness. You, throughout this whole pandemic, when the lights were out or going out, and the hardest times. Now that things are better now for sure. You've always kept the ability to inject humor, to smile, to see the brighter side of things, which is really healthy and important. Is that the way you've always been?
Well, thank you for saying that. It's funny. Over the years, people have said they thought I was humorous. I've never thought I'm humorous. Like I don't think I'm funny or humorous. As I've mentioned, I have 2 young children, so that they keep you, on your toes and funny. And my older one is asking me riddles nowadays, which are very stressful. because as a dad, you want to know the answers. But, I really have focused on, I try to control what I can control, and the rest, I try not to, get too concerned about. So in general, I probably am more of a glass half full than half empty person. And honestly, with all the challenges, I've been very grateful for the fact that I haven't traveled anywhere over the past, 16 months. And I literally have had almost every meal, breakfast, lunch, and dinner, with my family. And I otherwise wouldn't have been able to do that. I think my two sons are much closer. So I try to look at those bright spots. I know there's a lot of unhappiness and sadness, but, I'm trying to focus on what are the bright lines from here that we can, go forward with, because I can't control what has happened in the past. I don't want to repeat the past, and I want to improve upon it. And that's kind of the focus that I take.
Well, it's really an important quality. And I think it's helpful for people at a time when there's just such tremendous despair and just a time that we've been through, the likes that I don't think are comparable in our lifetime, and hopefully we'll not see again.
Mm-hmm.
Well, I think it's fair to say you have just an extraordinary and diverse experience in medicine and communicating difficult, complex data and information. And I think, we can all learn from you. I hope that in the future, we'll see better outputs from our federal agencies, because you, I think, touched on some of those important points in our conversation. But I think, you're a go-to for me as to what is the best way to communicate this. And so, John, thanks for all that you're doing. I mean, WebMD is an important information resource, but moreover, your whole career that you've done with, various U.S. governmental agencies, incredible background, and what you've done in Discovery Channel, WebMD, that's really unique in many respects.
Thank you. And, I never really acknowledged that I've been a big fan of yours for a long time. I've always kind of played it cool. So when I was a resident, that was the time when you were very prominent, even back then, in terms of cardiovascular outcomes, in terms of really being a leader and looking at, cardiac care. And that's one of my interests in health services research.
Yeah, we see that shows how old I am. You were in the crib.
Yeah. And then I came to a Scripps meeting, and I was like, oh, I'm John Whyte and all that. And I read all your books. So it's really an honor for me to be able to get to know you during this pandemic. And I really have looked to you and your Twitter feed and our conversations over the past year, really to help guide us at WebMD and Medscape as well, in terms of what we need to be covering. Many times I've asked for your counsel in terms of how we say certain things and what the evidence shows. So, I appreciate the opportunity to be able to work with you.
Well, thanks, John. One last question I'll ask you about. You've interviewed a lot of high-profile people, mm-hmm. and I think because of WebMD's reach, you have an ability to get to people like President Biden and others. Mm-hmm. Who has been the most interesting person you've interviewed, and who do you want to interview?
Yeah, well, I have to say, it's always great to interview Dr. Fauci. And that was during a time when, we really needed that guidance. And, I had a great conversation the other day with Dr. Collins at NIH, but I really talked to him about the concept of faith. Mm. I think he thought it was going to be all on COVID.
Yeah,
but
right.
I wanted to talk about faith. And as you know, his story, he was an atheist. And how do we balance this idea of faith and afterlife and resurrection with science and biology and chemistry? So that was a great discussion. But I have to tell you, some of the best conversations I've had, and I've been lucky that I get to interview interesting people every day, are some of these young go-getters, where I interviewed a senior in Texas who said, I still remember this, and I interviewed him last year. He said he wasn't alive, during September 11th, but he remembered people saying they ran to the fire instead of away from the fire. This gentleman's name is Taft Foley, and he wanted to run to the fire. Mm. So he set up this mobile testing unit.
Wow.
Drove around. I'm like, I couldn't do that now.
Yeah.
And he's, young and doing it. And those kind of inspiring stories, I interviewed a bunch of folks that signed up for vaccination. And really, back then, we didn't really know what was going on in terms of they stepping up and saying they wanted to make a contribution. So they've been some of the most interesting persons that I've talked to, for this past year. And I've interviewed 250 people. And it's
only
still going.
250? Oh my gosh. I didn't realize it was that many.
It's been a lot. I don't count people twice.
Wow.
So
that is really impressive.
I've been fortunate.
Well, keep up the great stuff. I know everybody in the Medscape audience will be appreciative of learning more about your background, what you're up to, the other side of the whole WebMD operation. And we'll be talking again soon. Thanks so much.
Terrific. Thank you.